Hello, my name is Jazmyn and in this presentation I'll be answering the question, what is an anesthesiologist? An anesthesiologist is someone who meets with all of their patients pre, during, and post-surgery to make decisions on their healthcare and proper medicine and anesthesia. They also monitor vitals during their patient's surgery, ensure proper recovery after surgery, and manage their patient's pain management post-surgery. Anesthesiology is a very diverse field, so an anesthesiologist can work in a variety of settings. The most popular setting is hospitals, but they can also work in physician offices, clinics where they input IVs, outpatient surgical centers to ensure recovery after surgery, academic institutions to teach the practice, and medical institutions where they monitor hands-on students. The education requirements are the same for most positions in the field, but licensing can vary depending on the specialties and subspecialties of the anesthesiologist. Anesthesiology requires a bachelor's in science and health studies or any other pre-medicine pathway. This degree takes 4 years to obtain and is offered at most universities, and it covers the basics of health and medicine such as biology, chemistry, and basic healthcare. After the undergrad is completed, a degree from medical school is required. This also takes 4 years to obtain and covers more specific topics such as pathophysiology, biochemistry, pharmacology, and anatomy. Additionally, medical school offers more opportunities for internships, clinical experience, and hands-on learning. After graduating medical school, 4 years of residency in anesthesiology is required to advance in the field. Residency often involves evaluation in clinical care and specialized care. Most anesthesiologists then go on to get their board certification in the field to practice in advanced settings such as hospitals. There are many different certifications that you can get, but 75% of anesthesiologists are board certified through American Board of Anesthesiology or the ABA exam. It must be passed in order to work in hospitals. There are many specialties and subspecialties that an anesthesiologist can focus on. Each one requires their own certificate through the ABA. Some of these specialties include pain management, which deals with pain-reducing drugs, cardiac anesthesia, which specializes in anesthesia for heart patients, pediatric anesthesia, which deals with children, neuroanesthesia, which deals with the brain and spinal cord, obstetric anesthesia, and critical care medicine, which deals with traumas. Some subspecialties require an extra year or two of fellowships, which includes extra training and extra certificates. Some of these subspecialties are critical care medicine, hospice and palliative care medicine, and pain medicine. Anesthesiology can be a rewarding line of work, but there are pros and cons to this career path. There is a competitive salary and job security which ensures that medical school debts will be paid off fairly quickly. Anesthesiology also has a pretty flexible work schedule, which means that anesthesiologists can take vacations, have personal time, and still care for their families and spend time with them. With increasing use in technology in the medical field, anesthesiologists always have access to new devices that will help them be more accurate with patient care during and after surgery. With this job, anesthesiologists can work in multiple different settings, which creates a diversity in the workplace. But with every pro, there is a con. Anesthesiology requires a lot of schooling and studies, which takes a lot of time and dedication to the practice. If you don't have the passion for medicine, I do not recommend this career path. Although they have flexible schedules, scheduling is very difficult to come by because there's a plethora of doctors in this field, but not as many opportunities to practice. Anesthesiologists do a lot of work behind the scenes, but they often go underappreciated when involved in patient care. And finally, the pressure to succeed in this field is very high. There's a ton of liability weighing on you when you're dealing with a patient's life in your hands. So, to summarize, anesthesiologists perform a variety of clinical procedures such as epidurals during birth, intubations, increasing their patients' airways, inserting IVs, and more. They have a flexible schedule that allows for more time to spend outside of work. There's a variety of different settings that an anesthesiologist can work in, not just hospitals. Anesthesiology is a rewarding career as you build a relationship with your patients and help them recover pre, during, and post-surgery. There's a lot of work and training that goes into this field, so if you have the passion and dedication for medicine, I highly recommend you pursue anesthesiology. Here are the references I used for this presentation. Thank you so much for listening.